Hi, Dr. Garima here again, and we are solving clinical scenario 18 from the ADC practice paper. Very interesting scenario. So let's right away dive into it. Mariam is a 57-year-old lady who came to your clinic complaining that she has difficulty eating after losing her back teeth. 57-year-old, not that old. She had extensive crown and bridge work overseas because she was unable to tolerate removable partial denture. She would like to have the molar on the right hand side replaced with an implant and would like your advice as to how this option would work. Okay, she wants an implant because she cannot tolerate RPD and there are no teeth, so the current crown and bridge is bothering her. Her medical history includes hypertension, which is treated with enalapril and angiotensin converting enzyme inhibitor medication, and obesity. This small word obesity is the key word in this question. You'll understand why. So don't think that she's just obese, that obesity has to play an important role in the upcoming questions. She provides you with a 10-month-old radiograph taken overseas. You can see a bridge, a cantilever kind of a thing. You review the radiograph and commence investigation. Her periodontal and surgical risk for implant placement in the area where tooth 4-6 was extracted. Okay. You notice some radiopacities near the coronal third of the root of teeth 4-3 and 4-4. You diagnose these as exhaustosis. What is a likely cause? What are exhaustosis? Exhaustosis are these radio-opaque areas. Now, in which conditions you will find? You will find that mostly in the bruxers. Okay, if you see many radiographs for the bruxers, then you will find exhaustosis. So that is your answer, that she is a heavy bruxer. Inadequate cleaning under the bridge can be radio opaque. It cannot be can be radiolucent. It cannot be radio opaque like this. Infrequent professional scaling and cleaning. Infrequent would also result in calculus, but you cannot have like a band of exhaustosis, like they have mentioned exhaustosis, not calculus deposits. Deep isolated pockets would be radiolucent, and history of bone-related disease is not mentioned in the question, so we are not going to go with that, right? So she is a heavy bruxer, that is the answer. Now, you complete a basic periodontal examination, BPE, using a World Health Organization ball-ended periodontal probe. During probing all sextants, you found that the black band of the probe was completely visible. Okay, now this is a very important question. See, whenever you have perio questions, usually they have one straight, sure, short answer. They usually are not unmarked question having multiple right answers. And periodontal index, the probe, etc. are very, very specific. I know you may not have, as a dental graduate from Asian countries, done many periodontal examinations and are very well versed with the WHO probe and other types of probes. But in Western countries, periodontal examinations are taken very, very seriously, and they have to be done comprehensively. So you should be aware of this subject, and I would suggest that get a WHO probe and start practicing in your own clinic. Ideally, you should be doing that for every patient. It's just that we don't do it. So once you start practicing, you will start remembering, because it's a lengthy chart and it has many ifs and buts to classify it as a particular grade. But now, since the question is there and it's one of such question is always asked in the exam, and you should not be confused in such questions because they're pretty straightforward. So before we again jump to this question, let's revise the periodontal chart. I've opened it for you all. So BP scoring codes. So the probe, you know how the probe looks like, right? Yeah, this is the probe. You can see this WHO probe. This is a probe. It has two bands. One at 3.5 to 5.5 and one is somewhere 7.5 to I think 9.5, something like that. Yeah. So the first black band starts at 3.5. Remember at least this much, if not anything extra. Now we come to this. This is very important. This is also very important, but right now let's focus on this. Black band and completely visible. Basically, it's saying that when you insert the probe in the pocket, the black band, the first black band, this is completely visible. It's not inside, which means that you have not gone beyond 3.5 mm. Okay, and there is no bleeding after probing. Because 0, 1 and 2 all have black band and completely visible. They have the same criteria. So then what is differentiating their score? In 0, there is no bleeding on probing. In 1, there is bleeding after probing. And in second one, you have supra or subgingival calculus and overhangs present. Okay. So you will have not only bleeding on probing, but you also have overhangs present. Okay, so now let's go back to our question. During probing all sextants, you found that black band of the probe was completely visible. So at least you know the score is either 0, 1 or 2, correct? Now you have to choose which one. Now there was bleeding on probing, so immediately it is not 0. It is 1 or it is 2. Between the interproximal area of 4.3 and 4.4, and you identify an overhang on the buccal aspect. So there is now overhang addition. So 0 is out, 1 is out, and the answer remains 2, correct? 3 and 4 are not a concern because the black band is fully visible. So now that you know that black band is fully visible and there's bleeding on probing and there's an overhang, your answer becomes 2. Now if you wouldn't have memorized this chart, then you would be thoroughly confused and you would have wasted your time on this question when it is a straightforward answer. Get it? You get it? So the answer is 2. I want you to pause this video. Go ahead, read that chart, memorize that probe, draw that probe, imprint it in your brain, buy that probe, do periodontal examinations in your clinic, start charting out so that you remember which sextant is which teeth and how you examine, because it would be in part 2, skilled OSCEs, you will have an examination like this. And remember the chart, right? Fluoride chart, teeth eruption chart, periodontal chart. These 3 charts you have to write down daily. Like, then only your brain will go for the right answer at the right moment. Now you further look at the risk factors for periodontitis. What in Mariam's history is a systemic risk factor for gingivitis to progression to periodontitis? I just shared this with my group. Let me open that so you understand. Yeah, this is my ADC enrolled candidates group and I've just shared this. Why obesity is a systemic risk factor for periodontal progression. So I've mentioned this in detail. Basically, obesity is a chronic inflammatory condition. Okay. So anything which promotes inflammation will always promote gingivitis to progress to periodontitis. Okay. You may think hypertension could have been the answer, but no, it is not. It's obesity. Obesity has many inflammatory precursors and it also promotes inflammation. So I want you to read more about obesity and its link to periodontitis. And that is why when the main question said that there is history of hypertension and obesity, I mentioned that word obesity is a key word because you will see why, and this is what sometimes people just tend to think, okay, it's just obese, just there's a lot of fat, what else? No, it doesn't work like that. Okay, so read more about obesity. Now you are exploring the surgical risks for implant placement in the area where tooth 4-6 was extracted, and in particular the risk of implant osteotomy perforating into submandibular fossa. What investigation will provide you the most accurate? Whenever they say you have to place an implant, you have to do a third molar extraction, eyes closed, the answer is CBCT. Don't even look at any other options. Option E becomes your choice. Further looking at the surgical risk, what anatomical structure should you identify where 4-6 area, basically the mandibular? There is only one structure that you need to know, and that's inferior alveolar nerve. Straight away that becomes your answer. So I hope you have understood this. Very, very good question. I'm very happy with this question. Read more about implant, the distance between implants, read about obesity, learn the BPE chart, the Williams probe, and more about periodontal disease progression and the risk factors. This question will make like 2 hours of your study busy, you know, like go into all this lateral aspects of this question, so you'll be revising other things as well. So again, a very good question, and read more. I've provided many such questions with detailed answers in my two books, Comprehensive ADC book and Ultimate ADC Companion book. If you wish to have a PDF of the book, you can just email me and I'll send you the sample copies. Okay. So have a nice day, and good luck studying for the exam.